Everyone, Kay Bergner here today with Dr. Tom Phelan, author and creator of 123 Magic, as well as the author of The Manager Mom Epidemic. Dr. Phelan, welcome.
Good morning, Kay.
How are you today?
I'm doing very well, and how about you?
Oh, I'm all right. Mostly recovered from last week where I sounded very, very silly with a very stuffy nose. But spring colds, I think, as the world is venturing out a little bit more, we're going to be back to experiencing things like spring colds again.
Yeah, as long as it's not COVID.
Yes, I did take a rapid test last week, not COVID. All right, so today we're going to be talking about ADHD and family stress. So, an ADHD child might be inattentive, they might be hyperactive, or they might be both, that combination type. I know you've mentioned in the past that hyperactive is really the side that people tend to think of when they think of ADHD, where, the child might be described as sort of driven by a motor, right? What kind of stresses does having an ADHD child at home create for a family?
Well, it's kind of an atmosphere of constant activity. I think there are a couple of things. One is a sense of negative anticipation. When is the next blow up going to occur? Is it going to be when I ask him to go to bed or ask him to do his homework or whatever? Another one that parents often get is sibling rivalry. In our house, sibling rivalry was the worst problem my wife and I faced. And with ADHD involved, sibling rivalry is terrible, with who initiating most but not all of the combat from that. So it's kind of I think the overall feeling is nonstop. You don't know when the next blow up is going to occur, but it does.
Got it. And you've mentioned before, ADHD is genetic.
Yeah, big time genetic. They say sometimes it's 80% genetic. Now, whatever that means, not always clear, but it's big. But that also means that what you have is you may have more than one person in the family with ADHD. If you're a child with ADHD, there's about a 50% chance one of your biological parents will have it, and a 30% chance that a sibling of yours, brother or sister, will have it. So we get families, you can have 2, 3, 4 people in the family that have ADHD, adults and kids. And it's kind of like, then, well, who's leading here and who's contributing to the chaos? Everybody's contributing to the chaos.
Yeah, absolutely. So what sorts of unique challenges might an ADHD parent who has an ADHD child face that might be different from a parent without ADHD who has an ADHD child?
Yeah, one of the things you're going to get is you can get tantrums that are frequent and extreme, and that can be very difficult. You will get also difficulty sustaining activities such as homework or getting ready for bed or getting up and out in the morning, way more than an average kid. So the things that normal kids or non-ADHD kids might learn to do as routine after a while, the child with ADHD will struggle with that, and you'll find yourself having to supervise and to remind, and you'll feel like a nag a lot of times during the day while this kind of thing is going on for routine activities.
And likely, if you're a parent who has ADHD, especially if you have undiagnosed ADHD, needing to be the one to get the child back on track and to reinforce the routine is probably going to be a bit of a challenge as well.
It really is. With 123 Magic, as you know, we emphasize calm and decisive in being a parent, being a good parent. Well, one of the symptoms of ADHD is emotional over arousal, meaning everything is a big deal. You get madder, you get more anxious and all that. But now you got this child who's not doing this and not doing that. And your ADHD as an adult, you're going to get more angry, and you're going to be doing a lot of things that'll be pouring gasoline on the fire. You don't want to, but that's what happens.
So what types of expectations should parents keep in mind when it comes to a child who has ADHD?
Well, it sounds terrible, but your expectation is going to be lower. We have a rule we call the 30% rule, and that's you take the age of an ADHD child, say it's 12, you subtract 30% from that, you get 8.4. What is that 8.4? That 8.4 is a more accurate estimate of the emotional and behavioral maturity of that child. So say a 12-year-old is in 7th grade and an 8-year-old is in 3rd grade. Well, it means in a lot of ways your ADHD child who's 12 years old is going to have the maturity of a third graders. So you need to have different tactics and different expectations. You don't expect the kind of sustaining activities, the kind of durability and the kind of attention that you would get from somebody else.
Got it. And I know that, you've discussed in seminars that you've done in the past, specifically around expectations, the ways that parental expectations can either add to or subtract from the stress in the household. So I think having very accurate expectations, like knowing what to expect and how to communicate that to your child, can be so helpful in this situation where it may end up being different for different children in the family, right? So for instance, my brother had ADHD and I do not. So as children, it was very evident to me that there were very different expectations for the two of us, but I think that probably really helped my parents to, kind of keep a little bit of their own sanity, right? When it comes to children's behavior.
You're right. Expectation, if you're the more inaccurate your expectations are, or the higher they are than they should be, means the more angry you're going to get. So I've said to parents in the past, you don't expect normal behavior from a handicapped child. I said that to one patient of mine. He was a physician, and he had a boy, a little 8-year-old boy who was ADHD. So don't expect normal behavior from a handicapped child. I said, my child's not handicapped. Well, I said, you call it what you want, but we don't expect normal behavior from a child with ADHD.
Got it. And you mentioned a little bit about behavior management earlier. So how does behavior management play into this? What can parents be doing around behavior management to sort of kind of keep a handle on the situation at home and keep their calm?
Yeah, I've said to parents, if you have a child with ADHD, you have to be a professional parent. It means you really have to learn, what's your strategy for your ADHD child when they tantrum? What's your strategy for them when it's time to do homework? If your strategy is just you yell back for tantrums, or for homework, you say, do you have any homework tonight at 4:17 in the afternoon? Those aren't strategies. They're not going to get you anywhere. You have to learn a program. It doesn't have to be 1, 2, 3 magic. There's a lot of good parenting programs out there, but you have to learn something so you're ready for bedtime. You're ready for the resistance you're going to get. Otherwise, you're living in la la land, and you're going to precipitate a lot of trouble.
Yeah. Absolutely. So it's all about having a plan, and when you know what your response is going to be, it takes the decision making out of it for you as a parent, and just makes it a lot easier for you to sort of handle that situation and keep your cool. And obviously we're a little biased towards 1, 2, 3 magic, which obviously has suggestions for how to stop the obnoxious behaviors, like the constant movement, the constant noise, as well as building those helpful routines and put a plan in place. The other question that I think a lot of parents grapple with, to medicate or not to medicate, what would your recommendation be here?
My recommendation is very, very clear. If you have a child who's been diagnosed with ADHD, you should do a medication trial, period. I think too many of us professionals we wimp out when it comes to medication. You say medication is an alternative. If you don't like it, that's okay. You can do multivitamins, you can do walking therapy. No, sorry, your kid only grows up once. The research shows very clearly 3 things work with ADHD: parent training, teacher training, and medication. And we have over 300 controlled studies showing that medication is safe and it works, and it doesn't cure anything. That's the other side of it. You got to learn about medication, but really, and if you don't like the idea of medication, do the trial, see what happens, and then you at least know what your possibilities are. But so many people, because of what they've heard on TV or wherever, they're afraid of medication and they're leery about it, and so they waste years and years. I've seen it happen. Waste years and years and years of their child's growing up time. Then they get to the medication. The medication works wonderfully, and the parents cry. I've seen them do it. They cry because they lost those years.
Yeah, absolutely. And obviously, of course, disclaimer, we are not providing personalized medical advice here. This is a generalized recommendation, and you should speak with your own healthcare provider about medication for yourself or your child. So next week, Dr. Phelan is going to be doing a free 1-hour seminar on ADHD and family stress. He's going to cover the topics we've covered today in a little bit more depth. He'll talk more about setting expectations in your home, both for yourself and your children, how to make decisive choices about medication and behavior management, and just generally how to have a happier, calmer house with ADHD. The other thing we wanted to talk about really quickly today was screen time. Which is sort of ironic because here we are on social media coming to you through a screen. But we want to talk about screen time for kids. So Dr. Phelan, can you speak a little bit to, what are we looking at in terms of average screen time for kids nowadays?
Well, I think you're looking at 8 to 12-year-olds about 4.5 hours, older than 12, about 7 hours average. And those two numbers, I think, do not include homework or schoolwork. So you're looking at big chunks of time.
And how does that differ from what, say, the American Academy of Pediatrics or the World Health Organization recommend in terms of screen time?
Yeah, it's a lot more. The AAP, for example, recommends no screen time other than phone chat up to age 2, and then like an hour over that. But those recommendations are largely ignored, I think. And so we have something that we have two different things. We have the ideal, the recommendation over here, and then we have what's actually happening in the big bad world, and it's different.
Absolutely. And, I think we've all experienced for ourselves, perhaps, some of the downsides of screen time for kids, whether it's shorter attention spans, irritability when you tell them to turn it off or for a couple hours after, disrupted sleep. Are there any upsides to screen time?
Sure. I mean, one of the upsides, obviously, is it's fun, and everybody has a good time while you're doing it. It also can serve some educational purposes. That's for sure. And it's interesting, Kay, when you mentioned some of the downsides. I think if you tell your kids it's time to stop, and you get a resistance, testing, manipulation, tantrum, or whatever, it's easy to associate that with the screen time. Some other things like attention span or irritability or poor sleeping, parents may not associate with screen time, but they may very well be associated with screen time. So it's important to kind of think about it and make that connection.
Yeah, absolutely. So, but obviously we're not here demonizing screens. As a parent who has had to parent small children through the pandemic, I fully admit that there have been times where I've said, you know what, we're going to sit down and we're going to watch 30 minutes of Netflix now. Okay, mommy just needs a quick break. And I don't think anyone would tell you that that's not okay in limited amounts. So next week, Dr. Phelan's actually going to be doing a quick parenting tip seminar, 8-minute parenting tip. He's going to talk about the risks and benefits of screens, if screens can be addictive, how to talk about the issue with your kids, how to set limits, and more. So we'll post links to register for both that and the ADHD and family stress seminar here on our Facebook page. You can also sign up for our newsletter at 123magic.com, and we send those links out as well. Thank you so much, Dr. Phelan. This has been terrific.
Thanks,
Thank you for joining us, and we'll see you next time.